6.5 million Americans suffer from heart failure every year. It's a very lethal problem, probably as lethal or more lethal than most forms of cancer. The biggest cause of heart failure relates to coronary artery disease. If a blockage forms in the arteries to the heart, then that can lead to damage. This left ventricle, which does the squeezing performance of the heart, becomes impaired, weakened, and that could lead to a constellation of important symptoms. Shortness of breath, that's the marquee symptom that's associated with heart failure. The conventional methods of treating heart failure really try to address the physiologic performance of the heart. But ultimately, those don't address the fundamental problem, which is the permanent damage that has occurred to the heart tissue. We are really in desperate need for new solutions, and that's what the CardiAMP heart failure trial is all about. Cell therapy is an area that is really emerging as a very powerful potential way of improving heart function in these patients. How can we improve the contraction of the heart? How can we improve the blood flow to the heart muscle? How can we draw out the intrinsic mechanisms that are in the heart that can lead to its repair? The CardiAMP heart failure trial is going to be potentially the first cell therapy that could be applied in patients, and that's really exciting. This is a phase 3 clinical trial. This means that earlier studies had been done to demonstrate that the entire process from beginning to end is generally considered safe. Now we need to know in a larger population of people if it actually works. We're taking a sample of patients' bone marrow, aliquoting them, enriching them, and then injecting them directly back into the heart. And the idea is to prove that the patients who got the cells have improvements in quality of life, in function, reduced risks of future hospitalization, and potentially reduced heart attacks and future death. It's very important to do clinical trials in this way because that's the only way we can advance science. It's the only way we'll learn whether cell therapy works. The CardiAMP heart failure trial is particularly innovative in 3 different ways. This is the very first trial where we select only those patients who seem to have potent bone marrow cells. One of the advantages of using your own cells is that you don't have to worry about rejection of those cells. It also potentially reduces costs to the system and to the patient ultimately. The second reason why I think it's important is that this is the first cell therapy trial that's really kind of looking at a very high dose of cells. So really it has the best chance of hopefully offering treatment. And the final very innovative thing about it is that it's very point of care. This isn't a procedure that requires multiple visits and multiple treatments. We think this is going to just simply be a single treatment done all in the cardiac cath lab from the bone marrow aspirate to re-injecting the cells back into the heart. Well, I'd like to thank you so much for your support, and we really look forward to seeing you and see if you qualify for the CardiAMP heart failure program.